Good morning, everyone. Thank you so much for joining. Excuse me. Obviously, the spring allergies and pollen are having an impact. But it is 8:03, and so I'm going to call this meeting to order on April 17th and welcome all of our Board of Health members and members of the staff as we talk about what is on our agenda, which is rather brief today. The original agenda, of course, has a call to order, approval of the March minutes, an update on changes in the city and some next steps, and then departmental updates. Dr. Mati needs to leave a little early. So let's reorder this and let's have her. We will approve our minutes and talk about our other agenda items after Dr. Mati has stepped away from the meeting. So Dr. Mati, would you like to provide your updates first?
Absolutely. Good morning, everyone. And I'm so apologetic that I'm not on camera. I'm off site in the community, and I'm not trying to stress these folks out. They were going to try and have a nice setup for me to join you all on camera, and they weren't able to do so. Happy Thursday. It has been a time at the city, y'all. New mayor in town, new comptroller in town, and the transition has been a historic turnaround. And so it has been a challenging time for the health department in as much as uncertainty. I'm very transparent with folks, and so many of the folks on the team were worried about and I had a lot of questions about what does this mean? What does this mean for you? And so I, in the spirit of transparent leadership, had a executive leadership meeting where we talked about candidly, that this administration, I think, has done a really incredible job of turning around and getting ready. They did communicate with the cabinet, I think at the day after the election or shortly thereafter, to let us know that they value the work of the departments and the department heads, that they will be making decisions in due time, and that they will reach out to us for meetings. I am yet to hear from them. It is business as usual at the health department. I was also transparent with the team that it was a time for bidirectional reflection as far as, what decisions I may be making moving forward, and that I will let everybody know as soon as that has happened. So that is obviously the breaking news. There isn't a whole lot that has impacted health. Fortunately for us, we've been able to continue our work smoothly. And with that, I'll ask Shantae to start sharing slides, and I'll tell you a little bit of the exciting things that we've been doing over the past month. It's actually been a really joyful time. So bear with us as we start sharing, and I will start there.
I am on the first slide, Dr. Madi.
Thanks so much, Shantae.
Yes,
As you know, you will be getting this today or tomorrow morning. And we look forward to sharing that with you. As always, you'll have a little intro from me, but let's talk about the three sort of big areas of community impacts. First, it was National Public Health Week. Shantae, who is on the call, led these efforts, a regional effort for a national public health campaign, and it was absolutely joyful. How many of you saw some of the communications? How many of you either saw us on TV or on the radio? I'm hoping everybody saw at least one sort of communication on the call. Anybody?
I saw you everywhere.
All right, I have one. Anyone else on the call? Okay, Kristen says the comms are amazing. Any of the other board members see
you all
us
did
out
an
and about?
amazing job
Oh,
with the
yes,
videos
definitely.
and just the imaging. I was like, oh yeah, they scaling up the social media content. So it was great.
Oh, that's fantastic. Anybody else see? I mean, you all should have received at least some written communications, but I'm not going to steal Shantae's thunder. She will tell you more about that. So that was really the biggest part of last week. It was an incredible time. It was a time to educate the public about core functions. It was a time to celebrate and sharing more details about that, and specifically our new advocacy campaign as well. So you will see that front and center. We're talking candidly about federal cuts. I have always led with transparency. I've always been the sort of leader that wants to come into community and let people know what is happening and why. And so we did kick off National Public Health Week with that as well. There have been 4 federal grants that were cut from our health department. They were in 3 main areas. The first was in the bucket of COVID, another in the bucket of adult vaccines, and a third that I forget the actual name of the specific name, but it was devastating because it is clear that there wasn't as robust of an investigation or of a review as to the truly diverse types of programs that are represented under those grants. It appeared to be a sort of a reflex to the sort of names, such as, you know, a COVID grant or a vaccine grant. St. Louis, you've heard me speak about here, has one of the lowest childhood vaccination rates in the state. So it was devastating to see funding cut for vaccines. And especially as we're seeing outbreaks of preventable diseases, vaccine preventable diseases such as measles. Most of you, I hope, have been following the news. The largest outbreak geographically has been in Texas, and there have been 3 reported deaths due to or associated with measles. I asked for the convening of the pandemic task force a couple of weeks ago. We met. I asked for discussions around the impacts of these federal cuts. I asked for us to discuss a regional approach to addressing measles specifically if it were to come. We met again on Monday, and we will be finalizing the first of its kind regional SBAR that I have asked hospital systems and health departments to partner on, that includes not only our clinical approach, but also how we should communicate with public health departments and center public health departments in their efforts to do disease investigation and surveillance. I'm so proud of the leadership that comes out of this department and how we continue to set the tone. And I'm really grateful to Dr. Alex Garza and the Pandemic Task Force for responding to that call and for working with us. It is really fortunate for the region that we continue to use that Pandemic Task Force infrastructure to convene and to make sure that the different hospital systems, including our federally qualified health centers, are centered when these things arise. So that was another big part of the federal cut discussion. Next slide, please. But what I was most happy to announce on the radio this week is that we are nearing the end of respiratory virus season. We officially have another month before we can call it over, but I have not shown you a slide that has influenza with a low number. This has been a historic flu season. We at its peak had not seen numbers as high as we had in a decade nationally. And we certainly saw records at different points in the flu season here in St. Louis. So it is really such a blessing to be able to see those that green. It has also reflected fewer hospitalizations. And so we are very grateful for that. I want to once again commend Shantae and her team. This was the most proactive community outreach and respiratory and communications respiratory virus season. They were proactive. We were the only health department that you saw with a dedicated campaign around flu vaccines, we had COVID tests at every single outreach event that we were at. And we facilitated more than close to 10 flu clinics, whether it was for city employees or for schools and in community. I am so proud of their efforts, and it is so great to be on the other side of this. Thank you to all of the Department of Health staff, whether they were involved in flu clinics, community outreach events, but specifically the comms and community outreach team. Next slide, please. I'm going to let you sort of peruse through the different sections, but I'll highlight one or two things from each bureau. When I say that we
Dr. Mahdi, you're on mute.
employee wellness events we do. I am really enjoyed these joyful pictures. This year we were line dancing. So this last month, the Behavioral Health Bureau put on, and so there were some fans, y'all. Where are them fans at? They were at the health department just a few weeks ago. There were line dances and communion. The Behavioral Health Bureau just does such an amazing job of centering not just the mental health of the community, but of our team. Next slide, please. In disease tracking, we continue to be educational. Aaron Ford, who champions this report, really is committed this year to making sure that the monthly reports also educate folks. So look forward to hearing about Cytosporidius and hepatitis A, E. coli Chaga toxin, and a little bit more about what they are and how they've been impacting some of our residents and community. Next slide, please. I want to shout out Tyrell and his team who are on the call. Their comms have just been incredible around. If you are not following the Health Stop on social media, they are on Twitter and Facebook. He this month was highlighting members of his team, and you will see an employee spotlight at the end of the report that reflects this. But he is also educating you all about the Take Me Home program that we have talked about many a time, and I'm hoping that he will grace this board with his presence later in the year to really talk about the efforts of HIV prevention. Next slide, please. Next slide, please. For family, school, community, and school health, they have just been really enjoying getting back to core public health. You will see a lot of the same numbers around lead and other things. I did speak about the unfortunate decision to scale back on fluoride in water in certain states. This has been a cornerstone of public health for literally decades, has saved the dental health of families across the country. So we will be communicating with you all more about that as part of our family, community, and school health efforts. Shantae, if we could go to towards the end, and you can just sort of slowly scroll. For environmental health, I'm really excited to talk to you a little bit more about our efforts for animal school and for animal care and control efforts in next month's report. Justin and his team will likely visit the Board of Health either next month or the month thereafter, but you will hear a little bit more about what our food inspectors do. And next slide, please. Lastly, as always, we will end the report. If you could keep scrolling with with our employee spotlight, please share the employee opportunities. Some last noteworthy events. If you could stay on noteworthy, I had the opportunity to visit Miss Ollie Stewart. She is what I call the GOAT and the OG in public health in the St. Louis region. This is a 90 plus because she gets very annoyed when I continue to share her age, but she's also really proud because she don't look a day past 60, child. Mobile, she was protesting for Social Security at all of 90 plus. She has been advocating for public health for decades. Please read more about her in the monthly report. I got to visit her and our seniors, had such a robust discussion. Shantae had me all over the news. I'm sorry if you saw me more than you would have liked. And shout out to our HIV STI prevention team who participated in the Links annual Black Family Wellness Expo at BJC Commons. And then in our live slide, you will see what's coming up next month. Please be sure to tap into some of the events where we will be. I'm so excited to welcome this the National Student National Medical Association chose St. Louis and medical students of color. They graciously asked me to be their keynote, and I will be speaking to 3,000 medical students and other guests on Saturday. This Saturday, really excited to welcome them into town. Join me every Tuesday at 9 on Streets 105.1. And you can see more events and where we will be in community to round out this event. We are coming into Mental Health Awareness Month and World Immunization Week. both those topics be in the public. Please share all of the things that you get from Shantae's team, whether it is in email or in our social media. And I will stop there and take questions about departmental updates or anything you heard me talk about today.
Dr. Mati, thank you so much. I do have a question about some of the data. As you have looked at flu cases, have you been tracking that data by neighborhood or by zip code?
It is really, that's such a great question. It is difficult to get to that level of granularity. As you know, in the past 6 months, we've just seen really devastating scale backs in our ability to get certain data sets at the federal level. Those, especially the CDC data sets, empowered us more to be able to do that. So the team is not powered to be able to report on those reliably and often. They are able to get figures from both the city and the county, but I will ask our lead communicable disease epi to confirm how confident he is about reporting at those levels, because I know that they have access to some of that information and what, why or why not they may feel comfortable routinely. Sometimes it's about the level to which you are powered to do so. And so I have jotted that down as a follow-up. Thanks for that question. Other questions or comments about what you heard today? Y'all are really quiet today. I'm gonna need somebody to say something. At least I got a smile from Colleen.
I was gonna say, despite a lot of transition, a lot of the unexpected unknown happening at the city level and really regionally and even nationally, you all have still persevered and were resilient in making sure that the public still has what it needs. And I think that stands the test of time and is definitely shows your leadership. So just very appreciative of the work that you all continue to do to show people that you're there for them, even when it's not easy. So congratulations.
Thank you so much. I think one thing that has been a hallmark of my leadership and what I've really tried to push is that this department is unafraid to say what needs to be said, to be first up to the table. But we really try to think about ways where we can reach people. Now is not the time to be polarizing. We have to really push ourselves to bring people in. People should wait. We are never afraid of questions at this health department too. And so we want people to ask us those questions. I think it's a really important part of public health and public health awareness and education. And so I think we're just fortunate to have built. There was not a communications bureau when I came. There was not a community outreach bureau when I came. Those were things that I felt were really important to build out, along with other new areas that have come under my tenure, whether it's our grants, the grants section, and of course our inaugural behavioral health bureau. But Shantae, Aaron, Willie, and Ivorian spend a lot of time really being thoughtful about the best ways to reach people. And I hope that showed during National Public Health Week, but always.
No,
but I'm not going to force myself upon y'all. If there is no other questions or comments, I will gracefully hand the mic back to our board chair. Thank you guys.
Thank you. I was just going to say the amount and the obvious level of partnership that you all have just across the region, across the city, is clear. And in times like these, it's obviously even more critical. So I thank you for, immediately upon taking office or taking on this role, 3 years ago, you have always been focused on relationship building and making sure that community members and partners knew that they had a friend in public health. Things are not going to get easier. They're likely to get harder given what we are seeing at the federal level. And as we talked about the last meeting, and I think in February too, if there are partnerships, connections um, networks that would be helpful to you and your team that you don't have, let the board know, because one of our roles, right, is to make sure that we are doing what we can to enhance your work. So if that means helping to connect you to partners or to folks who can help you with your work, then that is what we will do.
Gosh, I really, really love that. Thank you so much for recognizing that, but really for pushing me to really consider. Shante, if you could take note, I would really love to be able to share with this board and the community outreach team our listserv. It would be such a great idea to show us where there are gaps. You know, when I came, the listserv was about 50 people. We have built that to over 500 that we try to reach every month. You know, I introduced a monthly report right away. Well, not right away, but within my first year. And we've had the annual report that I introduced as well for the first time. And I just think that it's produced natural collaboration. What Shante is going to talk to you about after I'm done about what she did and how she led those efforts was all about partnership. You saw my face a lot, but you really saw all of the community partners. Everybody got their time and shine, and the videos were good. I was like, I shouldn't have been on the news all this time. I didn't know some of these people were media ready and media savvy, honey. It was just joyful. And so we're just fortunate. When you inherit a health department, when I started with less than 1% of the city's budget, did a short analysis, you know, a quarter the size that it should be for a city this size. My strategy had to be collaboration. I without shame, leaned into the incredible talents and honestly took the opportunity to shine upon the talents of folks in this region who had been doing the work for so long. It really bolstered our efforts, helped us to be better. And quite frankly, active listening of our partners has made us better. But I do think you should never reach stagnation, even though your numbers are, you know, went from, you know, close to 100 to over 500. So we would love to be able to share that, and the board can show us where we have gaps and who else we should be reaching. I love that idea. So I'll follow up with Shante in the coming week about next steps with that. Thanks all.
Thank you. On that note, I know Dr. Mati is now jumping off of this call, but I look forward to hearing more about how National Public Health Week was structured and crafted, and maybe some info about the impact. So I will turn it over to Shante. You're on mute.
It would be helpful if I turned off the mute. Okay, so I would be remiss not to give you a little bit of background as to where this whole National Public Health Week originated. The Department of Health, as well as St. Louis County Department or Health Department, are a part of a collective. It's the St. Louis Partnership for a Healthy Community that includes many active members who were instrumental in the development of the CHIP. In the past, they've expressed a desire for us to be more active and have a more active role in many aspects of either, you know, support of the CHIP as well as promotion of the CHIP. We knew that National Public Health Week was coming up, and so we presented that to our counterparts in the county, that we have an opportunity to let's get the information out about the CHIP. Let's share with the community. It would be also another awesome opportunity for us to gain more, you know, partners to be active in the process and to move this forward and truly realize the 5 priorities. So the National Public Health Week itself is the promotion of it was highlighting the regional community health improvement plan and its 5 priorities. We structured the actual week, National Public Health Week, to promote and amplify each of the priorities every day. And so we started out with, I believe, behavioral health. The next Tuesday was chronic disease. Thursday or Wednesday was it maternal? It wasn't maternal child health. Violence prevention was the last one. The intersection of economic mobility and health. That one is definitely near and dear to my heart. We definitely advocated for that because we do know that there is definitely a correlation between people's ability to thrive financially and their health. So, but every day we had several different types of mediums being promoted. We had commercials that rolled on KMOV, as well as radio spots. Um, and then we also had our social media, which was extremely strong. Um, we included Dr. Mahdi for live interviews throughout the week as well. We actually launched National Public Health Week with Dr. Mahdi on Great Day St. Louis. And then on Thursday, we had the pleasure of hosting Dr. Cunningham for a 3 p.m. show also on KMOV. And I forgot because I'm so excited about this. This makes me full. On the very first day of National Public Health Week, we started it with in our social media and also through our MailChimp with the listserv that Dr. Mahdi referenced, sharing a video where we had the pleasure of going to the mayor's office and having her or Mayor Jones provide a welcome, and then also a proclamation and to celebrate our reaccreditation, which is also something that's happened in the last year that was instrumental and definitely demonstrates our commitment to public health. As far as metrics and measuring the impact, first and foremost, I believe that I received hundreds, I would say, I'm exaggerating, but many calls letting me know that we were being seen and being heard and the impact is there. As far as numbers, we will be pulling those numbers, so we will be able to share that in a future meeting to tell you truly what that impact is. I can tell you preliminary, Larry, that we did see an increase in our social media engagement. As far as the KMOV spots, we'll be getting information from our partners at St. Louis or STL TV to give us how often and when they were shared. And so I believe by next month, these television spots will be running through the end of May. So we do have some time to truly to collect information and then be able to gauge impact. I really don't have too much more to say, except for that I was very honored to be active in this process. I truly appreciate all of the efforts of STL TV to support us. It's their great work that that really put the shine on our vision. And definitely the support of my colleagues here, Rhonda Bartow and Craig Schmidt, and moving things along as well. But that's all that I have to say about National Public Health Week. Oh, also, in the midst of this, we do understand, Dr. Mahdi also shared about the budget cuts, and that came to the fore like right as we were about to launch. And so we want to be intentional about sharing a call to action to the community, to our stakeholders, to our partners, you know, be in solidarity, saying, hey, this is how it's impacting us. We want to make sure that people understand how locally these budget cuts affect our community. And so with that, we have decided to start a campaign, and there is a folder which will be, it will be a living folder where we will be continually creating assets that can be shared out in the community. You will see them definitely on social media, and we will also make the determination if there's something that is of great impact, not that the other ones weren't. I will not minimize any of it. We may be able to even share them on our, you know, via our MailChimp, and then we also have opportunities to share utilizing our partnership with STL TV as well. So.
Thank you. I thought it was great. I was, you know, happy to see Dr. Mati and other folks from the team flooding my socials, Facebook, LinkedIn, all the things. Also just really happy to see additional staff people also get the chance to get a highlight. And I just thought it gave a really great picture of why public health is so critical to the functioning of a thriving city. So kudos, you all did a really, really great job. And as far as a call to action, because there were definite calls to action that you issued last week. Are there some that you would like for us as board members to highlight or to keep sharing? What would you like for us to do with some of the calls that you issued last week? Like I'm thinking about it was the food RX program. There was particular call outs for us to, contact, electeds and make it clear why these programs and the funds associated with them are so critical.
The intent of the calls to action is not only to make that ask of those that we interact with directly, those that we, that we partner with, those stakeholders that are currently active, but for them to also amplify the messaging that we share. If they're able to not only make that contact, but then also share it through their listservs. So we're getting the word out on how these cuts are impacting us locally, because sometimes I think people become detached. They just hear of cut, but they don't realize it's impacting our ability at the Department of Health to improve the quality of health for the department at large. So, or for the community at large. And so I think that what will happen is as we grow the call to action folder and those assets, we may go ahead and just share them with you directly with the ask to make those calls, and then to also amplify it through your networks if possible, just so that we can definitely get the word out as much as possible. Every contact, every share, it all helps. It all helps.
Thank you.
Mm-hmm.
I will open it up, pardon me, to other members of the board. Do you have any questions, comments?
I would say something. Hi, everybody doing? Good morning.
Good morning.
Thank you, Shantae, and the city health department for the call to actions. I was very happy and proud to see those being released. So I just definitely just proud and to support you guys in the call to action. So just wanted to make that comment there and support and agree with April on those call to actions being released.
Thank you. And I also wanted to echo something that April touched on in terms of the representation that was in our promotion this past week. I don't think that people realize the connectivity and how many partners work together with the St. Louis Partnership for a Healthy Community to make a difference. And so the representation that we had there was phenomenal, from our leadership in our health departments down to, we had Slate, we had, representation from St. Louis County. It was definitely phenomenal. And I hope that resonates with the community as well, that we're trying to make a difference in the region at large. So
I think it did. Obviously, public health doesn't stop at city or county lines. So thank you for certainly making sure that there was a regional feel to this, to all that you were doing last week, and just the work that the team does in general. Any other comments or feedback before we move on to the next agenda item? All right. Shantae, thank you. Thank you to your team. I know there was a lot of work that went into making all that happen. So thank you for just, making it a fun, thoughtful week.
Thank you.
All right. Because we did not approve our Zoom video minutes from March earlier, because we needed to give Dr. Mati time to speak before she left our meeting. I would like to go back to that agenda item since we do have quorum. And I will ask for a motion to approve our Zoom minutes for March.
So moved.
Is there a second? Thank you,
Second.
Colin. Sorry, who was the second?
I second.
Okay, thank you. All in favor of approving the March 20th Zoom video as meeting minutes, please say aye.
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 Okay. I hope that was everyone. Are there any nays? Are there any abstentions? The motion passes. We have approved our March Zoom video as the meeting minutes. Thank you. Okay, we'll move on to really what is the last agenda item, which is just to create space for us to talk about what this change in city leadership might mean for the efforts that Dr. Mati leads, or for the role of the board. Mayor Spencer took office and was sworn in on Tuesday. And I have not had any meetings with her or with other folks on her team about what she sees as critical areas for public health. But I look forward to hearing what those areas are. But certainly want to just, recognize that there has been a change, and we don't really know a whole lot about what might be next, except that we know public health will, or the work of the team will carry on as it has been, or as it can, given some of the funding cuts. But I don't know if anyone has thoughts or feelings about what they think the board should be focused on, or should take action on during this time of change. And Kristen, if there's something that you would like to chime in on, please speak up. But this question is really open to our whole board.
Good morning, everyone. Sorry, I'm off camera. My camera didn't want to work today, so there it is. Only thing that has just been circling my mind, just being very transparent in where I sit, as I process all of the changes, the simultaneous changes that are coming at the federal level and the local level, is just really figuring out where our position is to support the Department of Health, particularly Dr. Mati's leadership and the team. I am anticipating, but I do want to wait for more information. I am anticipating an increase in our presence, and our voice, and ensuring that, again, like the campaign Shantae's team released about how to advocate for funding to make sure that those cuts don't impact programs even further than they already have, particularly because they're so critical to the people in the community. My hope is, as more information is released, that we are able to come together and have a little bit more of an understanding where our advocacy is needed most. I know we started those conversations, and I think the best way to move forward is to not really pause, but I do want to wait for more information to understand how new administration is going to interact with the DOH and what their not promises, but what their supports are to ensuring that the people of the city are healthy as they can be. And so getting behind what their plans are. I know it's still funding season, so I'm sensitive to that and want to make sure that we're showing up for those things to support Dr. Motti as she advocates for the DOH and staff. But I guess I'm saying all that to say that's where my mind is. I'm trying to be very careful to not move from a reactionary standpoint, but I want to be sure that I'm sitting down and processing information effectively to make sure that when we are positioned to move, that we're giving our best, and it's thoughtful and intentional. And in the meantime, my recommendation or suggestion would be for us to continue to build relationships and get to know people in the city, particularly now more than ever, because partnerships are incredibly important, so that, you know, we can make this collaborative effort to uplift our region. And thank you, Shantae, for all of your work, for showing us what that looks like, and how successful it can be when we partner and do things together. So more to come. You'll hear from myself in April as it relates to the advocacy task force that we had discussed in a previous meeting. We kind of just want to wait to see how administration is going to respond to the Department of Health before we make any strategic moves. That's it.
Thank you for those thoughts, and for just naming that although we may not know some things, we can still take some action. And I also want to lift that Craig has offered up in the chat a link to know more about the transition team that is helping Mayor Spencer as she begins her term in office. And so I think a possible next step is for our board or members of our board to ask for some meetings so we can learn more about what the transition team is thinking or wanting to take action on, or what they might want to know more about. I'm not sure if folks on the transition team know much about the Board of Health, or what our role is or how we can help support public health goals. Enbal?
Hey, so just a quick thought about all this work and transitions. And I think, to me, I would really encourage us to continue doing what we've been doing, and continue growing the work that we had planned, and not even pause. I would encourage us to think that we shouldn't be influenced by local elections in this way. And I hope that's the case. But yeah, Craig, to your point, Drs. Ross and Garza are both on the team. They fully know the work that Dr. Motti's done, and that the community and the cities, that the Board of Health does. So I feel like it is our job to make sure that our Board of Health is supported in all the ways. And I do think that I love the advocacy angle that we're taking. Thank you. And I think that, Shantae, you're giving us exact things that we need, like something tangible that we turn around and transition and say, this is where and how you, what public health does. So I think I just felt like I have to say, A, I think we're in the right direction, and B, I don't think we hesitate or slow down.
Thank you.
Are we able to invite Mayor Spencer and some members of her transition team to our meeting?
Yes, we can ask any member of the public or the government to join us. Is that something that this body would like to do?
Yes.
Brittany, was that you?
Yes, it was me.
Yeah, I see
Yep.
Colleen with the thumbs up. All right. Well, that is a concrete action item for myself and Kristen to take action on after this meeting. And Bill, I support fully what you have stated in terms of keep on going. And our role on the Board of Health is one of the things that we're charged with doing, right, is supporting public health. And so I hope my earlier comments didn't make it sound like I was wanting us to be swayed by perhaps the priorities or goals of others if they don't align with public health best practices or norms. But I do think it is important to know where people stand. Any other thoughts?
I think the only other thought I would have is just, I'm not sure where we sit with all of the committees continuing to meet and push things forward. I know the Community Engagement Committee has continued to meet monthly. So to your point, Iqbal, of ensuring that we keep going with the work, maybe next meeting we could have updates on those behalves. And I know you and I, April, have been continuing to break down the advocacy pieces and trying to meet with Dr. Madi to make sure we're strategic. So yeah, Iqbal, I completely agree. I'm more of a processor, so I want to be sure that like who we're talking to are the right people at the table. Our strategy is a long-term, thoughtful strategy. I learned so much from Craig in advocacy that I do want to be intentional and effective. But yes, the work should not pause.
Okay. I'm not hearing any other comments or feedback. Is it a shared sentiment with folks that we haven't heard from that we should keep going the way that we were planning and invite leaders from government to join us so we can dialogue with them about public health needs? I saw a thumbs up. Okay, great. Well, thank you for those thoughts and those action items so we can move forward. The very last announcement, or actually there's two. One of them, of course, is that our next meeting is scheduled for May 15th. I will not be present. I'll be out of town. Kristen, will you be present and able to run that meeting on the 15th?
I believe so, yes.
Okay. Want to make sure that we can have quorum. So the other thing was I promised to follow up and I did not do a good job of it. But the tour of the behavioral health urgent care was tentatively scheduled for the afternoon of April 25th. I am still, it is my fault. I was still waiting for some folks to give feedback on what times and things worked for them. But I've heard enough feedback that it seems like 1:30 or 2-ish on the 25th would work for several folks. Just waiting to hear back from the Behavioral Health Bureau to make sure that that time still works for them. Once I have that, I will send a calendar invite out to the group, and those who can attend are welcome to come. And I think it'll be a really great tour. A lot of folks have had a lot of really good feedback about the work that is being done there. So that is something that I commit to sharing as soon as I have that date and time set. And then if there are other areas, I think we talked about animal care and control at our last meeting as another possible area where we might want to meet with staff and learn a little bit more about what the day-to-day work is and what some of the needs are. So that's something that we can also think about doing perhaps this summer. Those are all of our agenda items. Does anyone have anything else that they'd like to share before we end?
Yes, I do have a couple things to share. I got accepted to the Community Research Fellows Training Program at WashU.
Yay.
I want to share that with everyone. I seen Brittany at one of their cohorts. Sorry, I'm throwing you out there, Brittany. But just letting you guys know I'm doing that journey to learn more about public health and research. So I start today. And then also my graduation is next Saturday at Logan University. I'm getting my doctorate of chiropractic. So if you guys are available, please come. I would love to see you. Just want to share that good news with the rest of the board. And I'm so happy to see y'all today.
Congratulations, Chris.
Congrats.
Thanks all.
You have a lot of exciting things taking place in your life. So I will not be able to join you next Saturday, but I know it's going to be a wonderful day for you and for your family, and excited that we will soon be calling you Dr. Daly.
Indeed.
Yes, a lot of work. Also want to recognize Colleen, who has just taken on a new role also.
Yes.
So that's awesome. And if anyone else has any really good positive news, I encourage you to share it. I think people need all the positivity we can offer these days. But I'm really excited for the just incredible career paths that folks are taking that are also going to positively impact public health. So thank you everyone for joining today, for being a part of advancing public health in our city and really across our region. And with that, I think our meeting is done. And so I will adjourn us, and we will take the action items that we have talked about, and Kristen and I will help move those forward. So you can look forward to an email from me about the tour of the urgent care, of the behavioral health urgent care, and also plans for having members of the Spencer administration attend a future Board of Health meeting. So, all right, enjoy a wonderful week, and I hope everyone, despite the rain, has a beautiful rest of the month until we see you all again.